Hello, my name's Tia. I'm going to be your nurse today. Can you give me your name and date of birth?
Rachel Melvin, 4/21/1978.
Okay, great. Today I'm going to be performing a postpartum assessment on you since you've just given birth. I have already performed all my general principles and safety practices. I have done my hand hygiene and assessed her vital signs. So I'm going to begin by putting on clean gloves. And then I'm going to begin with your breasts and work my way down if that's okay. So at the breast, are you breastfeeding?
Yes, I am.
Okay, so to look at the fact that she's breastfeeding, I would look at the size and see if she's engorged. I would assess her nipples to see if there's any chapped or chafing or any blistering, and see if they will extend. But if she's not breastfeeding, I would also give her ways to not stimulate the breast and make sure that she's wearing a supportive bra if she's breastfeeding or not. I would also assess her discomfort level with that. And then next I would move on to her uterus, I would place a hand up here and 2 fingers at the pubis, and then I would massage the area if it was not firm, and that's what you want, is for the uterus to be firm. I would also check where the uterus is sitting. If it's at the midline, that's where you want it. If it's the left to the right, that would mean that she is probably not voided. Before I do this, I want to make sure she's in supine position, is already voided before we begin. Next, I'm going to go ahead and assess her bowels and her bladder. So I'm going to go ahead and listen to her bowel sounds before I start palpating. So I want to listen to all 4 quadrants. All 4 quadrants sound good. So then I would want to feel on her bladder and see if it is distended or if it's if she's having any discomfort. I would also have her void in the hat in the bathroom and assess how much she is her output. I'd also want to look at her bowel movement and how many she's having. Are you having normal bowel movements?
Yes, I poop very well, thank you.
You're welcome. Okay, so now that we know she's having normal bowel movements and that she's not having no issues with constipation, have you had any issues with urinating, any odors, discomfort?
Nope, everything looks good.
Okay, good. We'd want to assess her urine if she was for any colors or odors or anything like that that would signify an infection. So I want to move on to her Lakia and look at her, pull the pad from front to back, and then I would want to look at the color and see how many pads she's using. We'd want to assess the color, if there's any odor or signs of discharge. So then I would want to also look at her vagina and anal area, or perineal area. I'd want to look for any lesions, and I would want to look at her episiotomy for any signs of infection, all the sutures. I'd want to make sure that she's in no pain. I'd want to assess her level of pain if she was in pain. I'd also want to look at her anal area for any signs of hemorrhoids, swelling, redness, anything like that. And while I'm at the perineal area and was looking at Lakia, I'd want to do the H&H, look at her hemoglobin and hematocrit. I'd want to test her, see if she's rubella, and her Rh negative status, if she's Rh negative or not. I would also, if she had hemorrhoids, we could give her something for that to take the swelling down. Also, I would want to turn her over and look for signs of pooling or anything like that. So after her perineal area has been looked at and assessed, and she's having no issues with pads or anything like that, I'm going to move on to her extremities and look at her legs for any signs of swelling or DVTs or edema. She doesn't look like she is having any issues with that. I'd want to look at circulation and if she can move all her extremities within ROM. We'd want to see if she's having any pain when she extends her legs underneath the knee for blood clots. So you can put your leg down now. Lastly, I'd want to also show her in the perineal area if she does have any pain or discomfort, and we do not want her to wipe with toilet paper. We'd want her to use the spray bottle and pat it dry with a clean rag. And I would show her how to do that as well. So lastly, I would also assess her mental status. Are you having any signs of depression?
No, none at all.
Do you have a good support system?
Yes, I do. Yes, I do. Everything's good.
If you do have any issues with depression or anything, you can give us a call and we'll set up another appointment with that. Do you have any questions or concerns?
No, I do not.
All right, thank you.
Thank you.
I would also report and record all these findings if there's anything abnormal, and I would chart all the normal findings as well and have the doctor come in and speak with her. Thank you.